efforts, and they're meant to serve as a call to action to unite our community and bring action to the compassion and concern that is present and abounds from members of our community for our neighbors, our friends, and our families that struggle with housing stability. The Housing Task Force seeks to align the efforts of these stakeholders working to serve these needs in Augusta under a common vision that this body endorses and will lead us to a better future with better resources and better answers for the problems that our residents face. The Housing Task Force seeks not to arrest any of the business of Augusta, Georgia. We are not here today to dictate anything to anyone, but rather to extend the framework for partnership that we can all utilize and rally around to address this issue. We hope to empower this body as our community's leadership to make informed decisions and to solidify these actions under a common cause of ending homelessness in Augusta, Georgia. We'll talk to you briefly about the background that Ms. Bars alluded to, the history of the Homeless Task Force. We'll talk about the guiding principles that the group has used to structure these recommendations. We'll talk about our focus areas that have informed our strategies. We have 9 highlighted strategies we want to make sure that we have in front of you today, and then we'll take an opportunity to go through our detailed list of 8 objectives and the action items related to them. And as I mentioned, we will also have a presentation coming from our Homeless Street Outreach team as well. So again, as you heard Commissioner Johnson say, the Homeless Task Force was formed in 2021. With some clear needs in our community from a homeless service provision standpoint. We needed to see an increase in leadership, collaboration, and general public engagement around the topic of homelessness. We needed to increase the access to stable and affordable housing, increase economic opportunity and empowerment for our citizens that struggle with housing stability. We needed to improve their health and stability. As COVID-19 showed us, the issue of homelessness exacerbates pre-existing inequities in our health system. So addressing homelessness is key to ensuring that the most vulnerable among us are able to live healthy and stable lives. And most importantly to this conversation, we needed to retool the homeless crisis response system in Augusta, Georgia. The principles that were put in place to guide the planning process that informed these strategies and recommendations were to ensure that the leadership would guide the process. The iterative development of these strategies included feedback from all levels of our community to include elected leadership and members of this group as well. Decisions are based on data. We wanted to make sure that we were not anecdotal in our approach to homelessness. Individual experience is important in the conversation, but trends in our community show us where the investments need to be made to address the issue. As I mentioned, we engaged a wide variety of stakeholders from across the spectrum. We learned from prior experience, not just those here, but also from around the state of Georgia with partners that have had best practices. We took qualitative local data and made evidence-based research the core of the strategies that you see today. We ensured ownership from the partners involved. The stakeholders that I reference also include many of your nonprofit agencies you're familiar with in Augusta, Georgia that currently provide these services. We wanted to make sure that they saw the benefit to the mission of their organization and the overall goal of addressing homelessness in Augusta, Georgia as part of these strategies. We were sure to be innovative. We wanted to make sure that this wasn't stale and simply a recount of previous information that this community has seen. As you've probably heard Commissioner Johnson refer to, the 2004 plan to address homelessness was one that served as a baseline for us to build from, but was definitely needed to be iterated and improved upon. And most importantly, we tried to keep it simple. We didn't want to overflow with information. This is a complex topic. As was framed in one of our early homeless task force meetings, homelessness is but a drop in the bucket of poverty. I'm misquoting Commissioner Johnson there, but that's important context for us to remember that we aren't seeking to solve every aspect of poverty in our community through this task force, but we are taking a hard, straight look at the issue of homelessness and how Augusta, Georgia can move us forward. The mission of the Homeless Task Force is to lead a coordinated community effort in Augusta, Richmond County that is focused on the implementation of processes that end homelessness in this area. The mission will be accomplished by improving access to a continuum of housing options, service availabilities for persons in danger of experiencing homelessness, by meeting them where they are and by coordinating efficient and effective delivery of those services. We will also be collecting and effectively utilizing data to inform the policies, improve services, and meet the housing needs of our residents. And lastly, by increasing the availability of shelter, permanent supportive, and affordable permanent housing for our residents in Augusta, Richmond County. The task force has come forward to envision Augusta as a community in which everyone has a safe and affordable place to call home and the resources that they need to support and sustain it. To help set the context of the conversation, I wanted to present some information about what we know of the experiences of homelessness in our community. In the strategy document you've been provided, you see more details about the environmental conditions of where we are as they relate to poverty and homelessness within our community. But as you all are familiar with from presentations in the recent past, the point in time count every year is a major effort to estimate the homeless population in our community. That's an effort that takes place nationwide every year, typically in January. This year we did push back because of the concerns with COVID-19 and conduct this count during February of 2022. And I just want to highlight that these results are preliminary. We have an official submission process that Augusta does with Housing and Urban Development before we consider these numbers to be final and official. But the chart on the right does demonstrate what we have seen to be an increase in homelessness since Augusta's last full point in time count in January of 2020. An increase of over 100 total persons, an increase of nearly 100 single men in our community experiencing homelessness. These numbers, again, are estimates, but they do show what our eyes see every day, and that homelessness has become an increasingly visible concern within the community. And our evidence from the point in time count in February certainly suggests that we must be aggressive in our pursuits to address this issue. The driving principles that led the task force to the plan that you've been provided, the recommendations you've been provided with today, included equitable access to resource. Through our from our coordinated entry project, through our service delivery strategies, we need to ensure that persons experiencing homelessness in our community are provided with unilateral access to the resources that are available. We sought to deliver solutions that were designed to meet the needs of a diverse homeless population. We sought to align the information that our partners provide to meet the efforts of this common cause. And we want to bring a balance to both crisis response and long-term solutions. Housing is your ultimate solution to homelessness, but you must respond to the immediate needs of those in crisis in a unique balance to make sure that your community is safe and stable. And most importantly, from my opinion, is the principle of having shared accountability throughout our community for all the participants and stakeholders in the efforts to end homelessness in Augusta, Georgia. There are three principal focus areas that your objectives that you will review are focused in, and they come back to systems and crisis response. As I just mentioned, we want to make sure that we have processes in place as a community that are efficient and effective in delivering the available services to our residents in crisis. We focused on structural solutions and housing stability. What can be done to provide better opportunities in our community for individuals to be able to empower themselves and attain or achieve self-sufficiency in their fight back from the experience of homelessness. And lastly, we also our last focus area came around RAP supports and intervention. We wanted to make sure that the non-housing related service needs of our residents in Augusta who struggle with housing are being met so that they can have the greatest opportunity to maintain self-sufficiency and stability as possible. And as the federal strategic plan suggests to us, the prevention component is essential, as preventing new episodes of homelessness in your community has been shown to be the most effective strategy in ending homelessness in any community in America. What we are proposing through these actions is, again, a paradigm shift in what currently exists in the homeless service program. A lot of this is already underway through some of the great work of those nonprofit service providers and the efforts that have come forward from the Homeless Task Force over the last year. That includes a shift from programs that operate in isolation to systems that provide services in collaboration and unison. We go away from individualized activities and speak to outcomes as the goals of these programs to produce real life-changing impact on the residents of Augusta, Georgia. And we seek to end the conversation about transitioning folks from homelessness and focus our community on the federal strategic plan's emphasis on housing first as a solution to homelessness in our community. These are all paradigm shifts that we hope will help ensure that homelessness in Augusta can become rare, brief, and non-recurring. Excuse me. Now we're going to take you through some of our highlighted strategies that we wanted to make sure that you saw. These will also be shown as part of the objectives that we cover in the full body of the recommendations you've received, but these are the ones that are highlighted for your attention to make sure that we have an opportunity for dialogue in today's workshop to address questions as they come along. First on our list today to talk to you about is improving the quality, the capacity, and the effectiveness of our emergency shelter system. As you saw from the information shown on a previous slide from our point in time count, we have a lot of unsheltered homeless persons in our community. We also have a lot of residents that make use of our existing emergency shelters. So what we must do as a community is establish some standards that Augusta says meet the minimum bare acceptable level of what it means to provide emergency homeless shelter services. As recently as this week, the community has dealt with the fallout of what happens when a entity in the community provides these type of services in a way that's not appropriate and it does not ensure the safe and sanitary living conditions of residents in our community in crisis. So one of our first recommendations for this body is the adoption of some minimum standards that we would set in Augusta, Georgia to say in order to operate as an emergency shelter, you must meet these minimum health and safety standards, you must be code compliant for occupancy, and you must be in a building that is appropriate for residential use. In addition to that, a major concern that was voiced through our stakeholder input in surveys and conversation was the need for day services in Augusta, Georgia. Currently, the emergency shelter system operates on an overnight basis only providing accommodations for persons that don't have anywhere to go during extreme weather events, whether it be too extremely hot, extremely cold, or some other pressing weather-related condition. We need better options for folks during the day. We're very happy that the Housing Task Force has had some very progressive conversations on this subject matter. We have learned through the efforts of the Housing Task Force of an agency that is offering day shelter services in the Harrisburg community on a relatively small scale, but being very impactful. And so it is the recommendation of the Housing Task Force that we look to invest in partnerships like this organization to see it grow, to see the opportunities for persons who are experiencing homelessness to have a productive and healthy and safe environment during the hours of the day that they are not able to be in our overnight emergency shelters. We are ambitious to come forward with some future action items to see the additional development of day shelter activities specific to our downtown core, where a lot of our unsheltered daytime homelessness takes place. Again, this is an effort, a conversation, and a path forward that is made possible through the collaborative efforts of the Homeless Task Force, and we hope to be in front of this body with an update very soon on some new day sheltering options that can come forward for Augusta, Georgia. Beyond just the day shelter options, we have identified the need to establish more effective partnerships for our emergency shelter providers that exist with inpatient mental health and substance use disorder programs. We need a referral mechanism for folks that are in severe levels of crisis, specifically related to those topics, to be able to be referred from the shelter to a more appropriate environment. Oftentimes, as we've heard from community member, resident feedback as well, it is persons with undiagnosed or untreated mental health or substance use disorder issues that can make our existing emergency shelters a less welcoming environment than they should be. And lastly, the Homeless Task Force seeks to recognize that pursuant to recent conversations that have been had, it is not feasible in our estimation for Augusta, Georgia to ascertain or to pursue the capacity to construct and certainly not to operate the necessary amount of low barrier shelter beds that our community requires. We have a gap of over 400 beds between the express need demonstrated in the point in time count and the existing inventory made available. And so the long-term goal of establishing a new low barrier shelter in Augusta that incorporates day services on site as well as case management and other client care coordination at the facility is crucial to the effectiveness of Augusta's homeless crisis response. Again, the task force doesn't see the path forward where Augusta should be the responsible entity for that, but major contributors in our community do support effective partners that have operated in the homeless shelter space for a long time, principally the Salvation Army, the Garden City Rescue Mission, and the Augusta Rescue Mission. Currently, just to provide you with the information, the Salvation Army is undertaking a strategic plan in advance of launching a campaign to develop a new site to replace the Center of Hope on Green Street, as they've identified that the demand for emergency shelter beds in our community has exceeded the capacity of their facility to meet alone. Next, we want to speak to you about the importance of mental health resources when it comes to the subject of homelessness. As we all know, the last few years have been trying times for all of us, and those of us in the community that struggle with housing issues have exacerbated crisis beyond what the rest of us have experienced as well. With that in mind, there is no simpler way to see an impact upon the mental health of our residents who struggle with housing stability than to increase and intentionally focus mental health resources towards the needs of that population. Highlighted in this conversation is the recommendation that we establish a mental health court to address issues that occur with residents in our community that can sometimes cause their behavior to lead to a criminal moment. We know that mental health crisis is not best addressed through incarceration and other forms of judicial action. So the interventions that can be made available through a mechanism like your mental health court would help these clients achieve a more sustainable level of self-sufficiency. I have been made aware by Commissioner Johnson that one of the advocates for this concept, Judge David Watkins, is available today in the chamber. If there are questions we would like to address on this subject matter, I think he is prepared to address those. But again, this is an issue that many stakeholders have spoken to us on, and I want to acknowledge the vision and the leadership of Commissioner Johnson, especially on this topic. In unison with the need for a mental health court service to better meet those clients where they are, the Housing Task Force feels that a collaboration between our local law enforcement and mental health service provision community to establish mobile crisis response teams to better meet the clinical needs of residents in our community when they are experiencing episodes of mental health crisis is a more appropriate response than some of the current law enforcement engagement, some of the current engagements that law enforcement has at their disposal. The establishment of mental health case management partnerships would greatly increase the ability of residents with mental health crisis and housing issues in our community to find a path forward to self-sufficiency. Being able to align our unsheltered street outreach efforts with professional mental health resources would expedite the ability to connect some of our long-term or chronically homeless populations with the services that they need in order to return them to permanent housing stability. In addition to that, as you've heard me mention in the shelter comment earlier, we really need to develop the partnerships within our emergency shelters. That is where it is becoming increasingly evident to our service providing community that individuals that are having severe and persistent mental issues are not able to engage with the services available to them until they're able to address those mental health crises. So establishing some intentional partnerships to allow for the referral capacity from our emergency shelters into mental health treatment programs would be crucial to ensuring both the ultimate success success of that individual client, but as I referenced earlier, also improving the quality and the atmosphere of our existing emergency shelters as well. The next strategy that we wanted to make sure we highlight, as you heard me mention earlier, it's widely expressed that preventing homelessness in your community is the most important first step in trying to end homelessness in your community. With that in mind, we are recommending that Augusta as a collaborative, look for the ability to increase shelter diversion and homeless prevention efforts and establish a single point of access for homeless prevention services, similar to what we experience with our Marion Barnes Resource Center, also known as our Coordinated Entry Project for homeless services. Again, this is an important aspect of improving the residents' ability to attach themselves to services. Feedback that we've received throughout this process and that I've personally received throughout my experience with this working for this government has been the confusion that folks can face in crisis when they're not sure how to access the services that are available to them. We have seen great success on the communication or access point in the recent year with our partnership with United Way, the CSRA, and the 211 program for emergency rental assistance. That ease of access component helps uncomplicate, if you will, forgive that use of a term, the communication to residents when they are already facing crisis. Giving them simple, clear instruction on how to access their services that can help them is very important to making sure that those services are delivered effectively. The Homeless Task Force is proud to say that this is another initiative that has begun. It is not solely contingent or require the investment of resource from the city of Augusta at its onset. And providers and partners in the community have begun the conversations and process of seeing this resource and this single point of access come forward for our community. And this is another topic that we look forward to coming back in front of you all at some point this year to talk about the implementation and potential implementation and inherent success that effort will lead to. As you heard me to allude to Augusta's Emergency Rental Assistance Program, in which we have helped almost 4,000 residents with arrearages on their past due rent and utility bills through the partnership with United Way, that has also provided Housing and Community Development the opportunity to partner with our wonderful magistrate court judges and staff to assist residents in the dispossessory court process. We feel that cementing this element of that program for longevity in our community can be crucial. One tenet that you hear often in the social service community is to meet clients where they are. And when it comes to preventing homelessness, there may not be a more effective way to ensure that someone doesn't slip through crisis than to meet them at the point where they could face the declaration of eviction from their existing housing. So again, expanding and making permanent the partnership for service provider staff to be available to provide information and services about homeless prevention efforts in our magistrate court dispossessory or eviction court processes is a very highly recommended strategy that we have already seen bear fruit and be impactful in our efforts to address homelessness. Continuing there, one of the biggest cries that we heard continuously, both through the Homeless Task Force environment, but also through the Emergency Rental Assistance Program, is empowering residents that face potential eviction and housing crisis with better knowledge and understanding of their rights as tenants in our community. We have faced many, many instances just through the ERA program where residents have been misled or misguided and do not know that there are resources available that can help them address the issues they face beyond the financial ramifications with their landlords or property managers. We strongly suggest that with intentional partnerships be developed to provide legal assistance, both from existing providers like Georgia Legal Services, but also exploring the potential of leveraging a model that is used in the domestic violence world of pro bono legal support being offered through a collaborative partnership. Again, a lot of times folks that face housing crises are not being informed of the fact that they are being misled by potentially their landlords or their property managers about processes, about their rights, and even about the fact that if they are issued a writ of possession to appear in magistrate court, they have surrendered their rights when they don't attend those hearings. That is a big part of the educational moment that we've been underway with the ERA program, and we want to cement that legacy in the service culture of Augusta, Georgia going forward. You've heard us mention a couple times already the impact of our street outreach teams, and again, to make reference to the fact that sometimes you really have to meet people where they are if you want to be effective. That is probably one of the single greatest aspects of the Homeless Task Force efforts is the impact that has been made through these concerted, regular street outreach efforts. With very little exception, direct engagement with persons who are living in unsheltered locations throughout Augusta has not been a practice that has been followed on a regular basis. We have some small efforts, we have some anecdotal ministries that do go and meet people where they are, but it's never been the same level of a concerted investment of time and talent that we saw over the course of the last year with the efforts by the Homeless Task Force Street Outreach Team. With that in mind, this is another legacy of the Homeless Task Force's efforts to date that we want to cement in the legacy of this effort moving forward. We feel that the continued progressive engagement that can be made available through regular, structured outreach opportunities will allow more of our residents who face unsheltered homelessness to build the trust-bearing relationships that are necessary to connect them to the services that can ultimately help them alleviate or lift themselves from their experience of homelessness. We want to provide opportunities across everything we do, but especially in our street outreach environment, for residents in our community with lived experience of homelessness to participate, to provide peer-to-peer support. One of our early meetings of the task force that Commissioner Johnson organized had a young lady come and speak with our group who was a resident of one of the permanent supportive housing projects you'll hear me talk about later in the presentation. And she spoke to us very impactfully about how her ability to sometimes connect with people that she knew out in the community who were still experiencing homelessness was different than any person like myself in a shirt and tie, Ms. Bars when she comes through with her elegance. We have hearts and compassions to serve, but we sometimes are not the right messenger. And so we just really think it's important that we ensure that as we grow these efforts and continue to provide outreach to our residents with experiencing unsheltered homelessness, that we include residents in our community who are or have experienced homelessness as well. One of the best practices from another effort in Augusta, Georgia that we want to see incorporated into our street outreach teams is the development of a by name list. Several years ago, 2018, we came before you, we being Housing and Community Development, to speak on our partnership with the Veteran Housing Committee of the Continuum of Care and the Charlie Norwood VA Medical Center's homeless team. To talk about the by name list that was developed in unison with President Obama at the time call to action to develop the by name list of your homeless veteran population. I can tell you through personal involvement in that group over the years that escalation of engagement, that increase in the attention across the spectrum of service providers on the specificity of need down to the human soul. Not that it was numbers, that it was Daniel on line 1. That was the point where we really saw an uptick in our ability to collaborate across organizations and better address the unique circumstances that each of those homeless veterans faced. It's our recommendation that the street outreach efforts develop this by name list and that it be managed by our coordinated entry project so that we ensure that effective connection to the available resources is made as rapidly as possible, and that investments that we make in the residents in our community that experience unsheltered homelessness are pointed towards delivering them from that state of homelessness. And lastly, something that's been very beneficial in our efforts that we would definitely like to come back and be able to have conversation for official approval on some partnerships is the inclusion of more transit options, including free public transit passes for partners to provide to our homeless residents that are trying to make the connections necessary to put the pieces that have fallen apart for them back together, whether that be employment opportunities and job interviews, whether that be medical appointments, mental health appointments, whether that be interviews with apartment complexes for potential placements. We need to build intentional partnerships to help folks get to where they need to go. Not to digress too much, but something that we contextualize a lot in the planning environment when we talk about Augusta, Georgia, is that we're one of the largest, physically largest counties in Georgia. Right, from one corner to the other. We're 307 square miles of a county where homelessness exists in every corner. And so assisting people with transportation is crucial to ensure that folks that are on an outlying portion of the county that may not be close to where the services are being provided can still have access to those resources. Assisting those residents and getting to the existing resources through transportation assistance is extremely more cost efficient than trying to build models where those services come closer to where they are. Anecdotally, I will share and compliment and a service component that we've experienced with our emergency rental assistance program is a wonderful rideshare partnership that United Way has developed. When residents need to come to their office to provide documentation or sign paperwork, our partners at United Way are able to arrange that transportation for them for free through a partnership with Lyft and Uber that they have. So that is an example, an effective, in-use example of how we can be creative in leveraging some partnerships to better meet the needs of the residents to be able to transport themselves across our large county. The next recommendation that we wanted to highlight for you, it sounds a little fancy, but we wanted to be sure that we spoke directly to the efforts of this task force and what we estimate to be germane to the subject of homelessness and the reach and ability of our stakeholders within the homeless task force to impact. So again, as you heard me say early on, housing is the answer, right? Homelessness is ended by providing housing to people experiencing homelessness, but we do know that the affordable housing conversation in Augusta, Georgia is a bigger conversation than our task force can take on, full stop. So we want to recommend, as it relates to the issues of homelessness, that the Housing Task Force and future leadership of that group be provided a seat at the table, right? We want to make sure that the needs, that the voices of people experiencing homelessness are a part of the conversations that our community has when it comes to the development of affordable housing. Like many communities across America, we're not unique. We face an affordable housing crisis, right? There's a greater need than there is available units today, and there will be a greater need tomorrow than there is available tomorrow. But centering the voices of our homeless population in those conversations is important, and we feel the task force feels that is where the impact on affordable housing can be made, is to ensure that it's inclusive of the needs of those populations. Specific to that, the Homeless Task Force does want to encourage and seek the endorsement and the buy-in from this body to move forward and progressively engage with elements of the Augusta, Georgia government to pursue some changes to local land use policies and ordinance to see more creative affordable housing options come to our community. A lot of investment or a lot of time is spent talking about tiny homes, and that is some of what we are discussing, is creating more efficient, effective, and cost-effective housing opportunities for the most vulnerable in our community. But there are a wide array of land uses and what are known as accessory dwelling units that could be considered as ways to add to the inventory of affordable housing that could specifically meet the needs of our residents that are facing housing stability issues. And again, the Homeless Task Force would also like for this body to endorse and authorize us to work with elements of the Augusta government and other relevant stakeholders to include housing and community development, who has certainly been at the table during the task force environment, as well as the Augusta, Georgia Land Bank Authority, who's the director, has chaired our housing committee within the Homeless Task Force. Again, to identify resources to include land that can be better utilized to facilitate the development of affordable housing, but specific to the conversation of homelessness. And I will certainly go into more detail about this shortly, the development of permanent supportive housing to meet the needs of our chronically homeless population. We could not bow out of the conversation of affordable housing without saying that prioritizing the development for the most vulnerable in our community is important. We don't shy away from the fact that residents that, in the HUD language, are at 30% of our area median income below the very low income in our community. We need to be more intentional in Augusta about how we get the units developed that they can afford from a rental perspective. And generally, this is not a call to action just for Augusta government, but this is across the stakeholder community. We need to advocate and solicit for more flexible funding to help meet the unique housing needs of our homeless population especially. Again, the intentionality of development is what can help solve some of the highest barrier clients' problems in our community, is producing units through partnership that are designed to directly benefit our chronically homeless and otherwise burdened members of our homeless population. To expound on the topic of permanent supportive housing, this was a strategy that we felt was very important, and this represents one of the substantial resource conversations that we are going to have in these strategies today. Permanent supportive housing, it's a programming type that is recognized by U.S. Department of Housing and Urban Development, intended to address the permanent housing needs, again, as I said, of your chronically homeless population. That's persons in our community who have experienced homelessness either repetitively or for long periods of time and possess some form of a physical, mental, or developmental disability that suggests that their path forward to self-sufficiency is going to be much harder than your average citizen. So this is a model that began in the 1980s in New York City. I've said to many on this group before, and I encourage today, there's a story from Malcolm Gladwell, a paper called $1 Million Murray that encapsulates all this. And just to give you the short reference there, that story tells us that in the 90s, or early 2000s, a gentleman in New York City experienced homelessness for 12 months and had conversations with Mr. Gladwell. And they calculated he utilized about $1 million worth of public resources to experience homelessness through their shelter systems, their food banks, their soup kitchens, their clothing closets. At that time, these numbers are obviously dated, but at that time, Murray could have found himself in a permanent housing solution through a permanent supportive housing program for somewhere of the order of about $50,000 or $60,000 a year. And again, experienced housing stability instead of experiencing homelessness. So when we talk about making smart investments, when we talk about being cost effective and efficient, permanent supportive housing is one of the greatest catalysts in the conversation about homelessness that our community can invest in to ensure that we make true, measurable, and visual impact on homelessness in our community. The Homeless Task Force recommends a short-term and long-term approach to this recommendation. In the short term, we would like to continue with the development of partnerships with private sector partners to leverage financial resources and develop initial units that demonstrate for this body and for the members and stakeholders of the Homeless Task Force the effectiveness and the impact that these types of developments can have, and help us to iterate and to establish and iterate the framework for partnership of this nature to lead to the development of future units. Over the longer term, we would like to see Augusta adopt a permanent supportive housing initiative that combines city, federal, and private resources, and to strategically create a pipeline that will assist us with the development of between 50 and 75 new units of permanent supportive housing by 2025. One of the key tools that Augusta has at its disposal right now to be able to jumpstart or begin this effort will be the recently awarded Home ARP Award that we have spoken to this body about in 2021. Those are funds made available to Augusta, Georgia, currently through Housing and Community Development from the U.S. Department of Housing and Urban Development that are intended to develop housing solutions, with the only difference from our typical home program being that they must be for the benefit of people experiencing homelessness. We have had conversation, and there has been action taken by this body to suggest those funds should be invested in the development of a non-congregate shelter. But back to our earlier recommendation, we do not believe that those funds are sufficient to provide the capacity Augusta needs to meet that requirement or to meet that call. Instead, an investment of these dollars and resources, again leveraged with private support, towards the permanent housing needs of our chronically homeless population. The 71 people I showed you on the slide about the point in time count is a much more efficacious use of those resources to help move the conversation forward on addressing chronic homelessness, which is often your most visible homelessness in our community. The next recommendation speaks to an issue that we have long known to be a concern in Augusta and have yet to find the appropriate solution for. Again, there's a fancy term there. We couldn't get away from the HUD language that recognizes this, but it is rather simple to explain. There's a lot of folks in our community who experience homelessness at the point that they become required, to say it one way, or necessary to be in a hospital, a jail, a prison, God forbid our foster care system. And right now, there is no intentional partnership in place to ensure that those persons, when they leave those institutions of care, do not leave them back into a state of homelessness. So that's what the fancy term institutional discharge means, is we need to set up mechanisms in our community through intentional partnerships that better allow for persons specifically in our jails and hospitals to not leave those settings back into homelessness, and especially not back into unsheltered homelessness in our community. We need to expand existing housing options and workforce development programs for persons leaving our correctional system. The Georgia PRI, or Prisoner Reentry Initiative, is an example of partnerships that need to be invested in, but more work needs to be done to ensure that formerly incarcerated persons are not facing further crisis when they leave their state of incarceration by leaving into a state of homelessness. The next recommendation is important, and it's one that the task force expounded upon, but again is going to be an iterative process that will require intensive collaborative efforts, because the need to improve the self-sufficiency of our residents experiencing homelessness is crucial to their long-term success. It's crucial to the stability of any household that's assisted through the homeless service system to ensure that they don't return to that system in crisis again. And so we don't seek to necessarily reinvent the wheel with this recommendation, but we do seek to develop a more intentional focus within what exists today in the employment training opportunities in Augusta, Georgia. We would like to see the development of partnerships that facilitate job skill training like programs that are attuned to two conditions: the skills and capacity of the residents that we're working with, and then also the demands and needs of our employment market. Those are two unique conditions that we have not necessarily seen implemented through existing workforce investment opportunity activities to this point. And we think that with more intentional development and advocacy from task force stakeholders, we can see programs that are developed to provide those crucial skill building opportunities to help lift persons out of the state of crisis that they find themselves in. Specific to the Augusta, Georgia government, we feel that if investigation of the ability of our government to incentivize hiring of people with the experience of homelessness in their history, especially groups that are generally marginalized in the homeless conversation, to include people of color and our LGBTQ community, that would be an important symbol and sign of progress in our efforts to address self-sufficiency as a tool that all of our residents in crisis can work towards to help alleviate them from their crisis, but also, again, inform and provide for their long-term stability. At this point, Ms. Bars is going to come and speak to us a little bit about her belief in the need to continue the structure of this task force and to formalize the structure and partnerships that exist within it a little deeper.
As Daniel spoke about a plan that Augusta developed in 2004, and I happened to be part of that plan. I was at the table. The group was formed very differently than the group that we have today. But one of the things that I wanted to look at was that plan. And so we did. We researched the plan, we looked at it, and here's what I found. We had a really good plan in 2004. For its time, it was dead on the money. It failed. So we looked at, why did it fail? And I'll tell you, it failed because leadership changed, community leaders moved, stakeholders left, and the plan sort of faded into oblivion. When it first came out, everybody high-fived each other, patted each other on the back. It went to HUD. Everybody said, good job. And again, it failed. And so in looking at all the work that you see here and on your monitors, we were determined that this would not happen to us again. And so we looked at ways to make sure that it didn't happen. And I think very strongly that we need a position called Homeless Crisis Response Coordinator, or whatever you want to call it. There needs to be somebody leading this initiative. For the past 9 months, I've been doing it. I will tell you, there is a groundswell of community support that we need to move forward with. There is not a day that I don't get 1, 2, 3, 4, 5 calls saying, hey, we're Trinity on the Hill Church, and we want to help. I got a call yesterday from Wesley United Methodist. Other people are coming to the table. Somebody needs to carry this forward. And so I would like to suggest to you that you hire a full-time position to manage this program and make sure that I call connecting all the dots to move these initiatives forward. That person would report to you on the strategies and would let you know where we are. As strategies are accomplished, new ones are going to be added. This is the time. We cannot afford to fail, and I ask that you consider this a strategy. Thank you.
Thank you, Mrs. Bars. So those were the 9 major strategies we wanted to highlight for you. Again, those are contained in the document that you've received as well. But we wanted to just take a quick moment before we transition to the full objective conversation. Open the floor up for any discussion or questions that may be had.
We're going to go down to, thank you for that. We're going to go down for questions to Commissioner Sonny.
Thank you, Mr. Chairman. Mr. Co-Chair, if you really want me to wait, I can wait until you get through and finish the presentation, I'll come back if you want me to.
Okay.
Thank you.
Let's get Sharon.
Okay. At this point, we would like to offer you an opportunity to see the presentation from our homeless street outreach team. So I will introduce and give her a minute to come up. Corporal Sean Rhodes from the Richmond County Marshal's Office, who was one of the leaders in our homeless street outreach efforts and has for many years worked in partnership with Housing Community Development and our nonprofit stakeholders to provide leadership and guidance on our annual point-in-time count effort as well.
Thank you, Daniel.
Thank you.
Just take one minute. I expected questions, so I'm taking a little bit of time. I'm sorry.
As she gets set up, I want to just highlight that these are pictures and information that brings to life what was just mentioned. And after you have an opportunity to share these, we're going to open up for questions from the commission. But I want to just highlight again that these photos and what we're getting ready to see brings life to what Daniel just spoke of.
Oh,
And
absolutely. This is for real. Hey, I know all of you. My name is Sean Rhodes, the corporal with the Marshal's Office, and as the co-chair for the Street Outreach Team, I'd like to share with you the progress we've been making throughout this endeavor with all the great support of everyone here and of course of you all. And a lot of you came out with us. It was very exciting and eye-opening for sure. So basically the mission was to engage the individuals living in the unsheltered community, to assess their needs individually and collect that data because until we know what we're dealing with, we really don't know what we have. So what exactly did we do? So we held 5 separate events involving numerous participants, city workers, nonprofit individuals, law enforcement. And while we were doing that, we were actually teaching our law enforcement officers that are usually the ones that come in contact with them how to deal with them and offer them the resources that they may need. It was very successful. So again, those were 5 separate events. We found 7 individuals that we were able to connect with families in faraway lands. We placed them on a bus, received donations from various nonprofits. Miss Linda made all that happen. We made them lunch bags, gave them clothes, blankets, and sent them on their way. Before we would do that, we would make contact with the family members or representatives from various VA departments and some psychological institutions that were used to working with this individual. And we would send them there, check on them when they got there. If we were not able to connect them with a resource or a family member, then we did not offer that resource. We don't want to bus people somewhere and just let them be. They're here, and so we're going to deal with them. All right. Let me see. Sorry. Okay. Data collection. So, this was the good part. We worked tirelessly with IT and the different team members that are that are a lot more knowledgeable about this homeless situation than we are. We deal with them. We're just not very aware of the different resources and issues that we would come across. So basically, we asked their name, age, disabilities, next of kin, how long have you been homeless? Why are you homeless? Then we asked them if they were employed, suffered from any disabilities, any disabilities. Do they want to be employed? Do they have trade skills? And we documented that information so that we could connect them later on with that type of job duty. And there were a lot that want to go to work. It's not a question I usually ask them when I make connections with them. I was very surprised at how many do actually want to work. So, outreach surveys. Let me refer back to some other notes that I took before we got here. Our wonderful IT department put this together. I don't know where there she is. Put this together. We all designed it and built it to meet everyone's needs. It is real time. Some of these numbers are a little dated. But if we were to go in and put a survey in the database right now, and it was real time, it would flip before your eyes to show you exactly if they were to be, a deputy were to be taking a report in an FI card, that stuff would come over pretty quick as well. So we're able to connect a lot of those dots. And if we're all talking, then we all know what's going on. So as you can see here, the outreach surveys that we performed during this time was a total of 280, 190 for that event that this PowerPoint was focused on. The clients, the total encampment areas are also documented in this diagram. The 311 calls, which is something that we just started for the citizens to be able to call in. And again, over here on the right, you can see FI card, arrest, case report, citation. And then the point in time. So you can actually go through and separate all that data and have it on an Excel spreadsheet, however you want to utilize it. These numbers are not including the individuals that are currently incarcerated, which we have listed at 90 as of today's date. Any questions about that? Okay, good stuff. Who are our homeless neighbors? I mean, a lot of people expect us to go in and find a bunch of people that just don't want to work, want to drink, do drugs. Well, that's not it. It's a lot bigger than that. 9% of our homeless population on our streets right now is employed. May work third shift, not able to meet the demands of a shelter, get back in time, and/or get the transportation to get back in time. 38% of them reported having a trade skill. They want to go to work. They will see me. Miss Shawn, you found me a job yet? And once this program is developed, we'll be able to fit all those pieces together. 17% receive disability. I asked, why aren't you in a personal care home? Why aren't you somewhere you can receive those benefits? 9% are veterans. We designed our street outreach team to have representatives from the VA on the team that were able to assist these individuals there. So we're hoping that right now the number is probably more at 4% as far as the veteran population. The average age of our homeless population in Augusta, Richmond County is 44 years old. That's scary. The encampments. As most of you know, this is probably how I met most of my homeless friends, is through these encampments, receiving calls through code enforcement in the marshal's office regarding trash and debris. It's very hard to go out and I guess, get on to these individuals. You've got to clean up. Oh, we received a complaint about you being on private property, or you can't block this bike path with your stuff that everything that you own in the world. You can't do this and not have the resource to provide them. And all law enforcement deals with that. I mean, that is the biggest hurdle that we're facing today. We need to have that resource. All right, let's move along. These pictures are kind of small up here. You really can't see exactly what we're dealing with. In this photograph, I do believe that we had a heroin user there. There were approximately 30 to 40 used needles laying on the ground. This is very close to a path near the canal, walking path. And all of these are different areas of our city that are housing individuals in encampments. I'm trying to see about my numbers. Let's see. Okay. These are kind of old. So I'm going to say that I'll go ahead and tell you, as law enforcement officers, we are tasked to protect and serve the entire community. That is the individuals that call about interference with their business by the homeless community, blocking the bike paths, individuals sleeping in the parks while the children are trying to play. And again, we have to respond. We have to do it for everyone. And of course, with the marshal, I mean, we're tasked with keeping our city clean and safe. And when you have encampments in local parks and in walkways, that's not something that, I mean, we don't usually know, our deputies don't usually know that they're walking into an encampment. They get there about the litter complaint or the illegal dumping complaint, and, oh, it's an encampment. Sean, come over here. You know, they don't know the difference because they're hiding out in the woods. So I just say that to say that we're in desperate need of the resources to get these individuals where they need to be. And we will keep law enforcement up to date on what those resources are so that they can point them in the right direction. So here's some of the gaps that we were able to uncover during our street outreach. Detox. Without insurance or cash on hand, it can be hard to access. One of our team members actually called pretending to be a homeless person. I'm on heroin and I want to get off. An hour later, she found out it was going to cost her $4,000. She told him she was homeless. I'm homeless and I need help. $4,000. So we took some time, made contact with some state organizations that was going to receive some funding and worked around a couple of things, but that's kind of a temporary thing. They're kind of working with us as we do this, so that's something that we could establish on a more permanent level. Mental health services, that's a struggle. That's a struggle in Georgia. That's a struggle nationwide. Hopefully we'll be able to get through some of those boundaries with some of the other legislation that's coming down the pipes. Food and clothing, we have multiple locations to access services throughout our city. That was pretty easy. You're not going to go hungry in Augusta either, I don't think. There's plenty offering food. We're really good at that fast, quick fix. Let's take care of them right then. You're hungry, you're cold, let me get you a blanket. You know, it's the long term, I think, was our struggle. Transportation, Daniel hit all over that. I don't think there's any more reason to go into that. GCAL, this was the resource that we were able to come up with that day. Got on the phone with them, spent about an hour with different members of management. They understood our need and are willing to help. So this resource has been sent out to all of our law enforcement for sure. So what about Sonny and Cherry, our two ladies that we did the blind study on? They're doing phenomenal. Sonny is back home with her family. She is well. And then Cherry, we are working on her. We'll provide an update on that as soon as it becomes available. But they are not living on the streets and they are no longer homeless. So that's the important. So I guess this is a little old. Sorry. We've already done the point in time. It was a lot of fun and very successful.
Thank you.
Y'all have any questions?
Thank you so much. And again, we've seen a lot of important information coming at us rather quickly. But now we're going to go ahead and take some questions from members of the commission, and we're going to begin with Commissioner Hassan. Commissioner.
Thank you, Mr. Co-Chair, once again. Appreciate it. Mr. Daniel, will you go back to, on your end, slide 29? Thank you. That's it. At the bottom, allocate funds awarded under Augusta's Home ARP Award for broader implementation and scalability. Is that the $2 million that you're talking about there, or there's some additional money?
Yes, sir. The full value of the Home ARP award was a little over $3 million, almost $3.2 million, and the original conversation at the commission level was to allocate $2.9 million of that towards a non-congregate shelter.
Okay, and so do we have the latitude to do something different with it, as long as it remains toward homelessness?
Yes, sir. Yes, sir. Just like our normal home program, we can develop a new allocation plan, inform housing urban development, provide the community with a 30-day comment period, and move forward at the will of the commission.
So are you asking both, or are you asking one, in terms of to build some sense of affordable homeless homes, as well as building this, what is this, the little small home, what you call a small home? Tiny home. Tiny home. Are you asking for the money to do both of those, or one or the other?
So the opportunity to develop tiny homes is something that we have found from these conversations that needs to happen in Augusta, Georgia. As we understand it, that's not available to us right now. That's not within compliance with our code for structures right now. We must build 750 square feet or larger. So our recommendation is actually to follow that model. If I could direct you to the units that currently exist on Sibley Street, known as the Village on Sibley. Those are examples of permanent supportive housing units that meet Augusta's existing code, but are cost effective and energy efficient in a way with that less than 800 square foot footprint that we feel could be very viable models to follow from a design standpoint to begin the implementation and creation of these units.
Now, just remember also that when you started out the presentation, you did ask about changing some of the laws that govern how land is used.
Absolutely.
So that does give you the flexibility to still deal with a tiny home, but I think the commission would agree with me on this one. If you go that route, you do that in a certain parameter in of itself.
Absolutely.
You know, so you still have that latitude about the tiny homes, because that's where the conversation really started. So you're saying now that you all are not necessarily interested in doing tiny homes?
I think that long-term we do need to do that. Now, to acknowledge what you just said, sir, one of the concerns we have with tiny homes, the way planning may describe it is it doesn't conform to the area around it. So the placement of tiny homes, especially in concentration, that needs some time to fit into the appetite of our community in our estimation. As I referenced those units on Sibley Street, they don't look any different than the other houses in the neighborhood in the Old Town area. You know, they fit the character of the neighborhood. So we want to see immediate action, which would suggest that we should look to develop units that are able to fit the existing character of the neighborhood now, as Augusta works towards growing into the ability to incorporate smaller units, tiny homes, accessory dwelling units. But we feel like those conversations need a little more runway than the sense of urgency that we're expressing for the development of these permanent supportive housing uses.
The homes that you are mentioning, are they for sale, or are they being leased or rented?
They're rented units, sir.
They're rented units. What you do? You got an idea what it costs to build them?
Well, they were constructed almost a decade ago, so their exact costs are a little inflated today. But our hope and estimation is that we could see these units built for somewhere in the $75,000 to $90,000 range on the high end.
Okay. So most of this will come in your mind will be up under the housing authority, because so much of this is already can be done by you all without us doing anything, you know, other than just informing us. Because I think the housing authority, in my mind, of the hood, I mean housing authority. I mean Director Welch's, Mr. Welch's department should deal with most of this, in my mind, in many ways. Have you all also, and this is a question for yourself, Mr. Co-Chair. I know per our earlier conversation, you probably want this to go on the agenda very soon. In asking that, what are you asking for us to approve your game plan? Because at the time you don't have any figures here in terms of what kind of numbers. I know you're going to have a collaborative effort, but at the same time, I want to know what kind is going to be an ongoing, reoccurring financial incentive that you're going to need from the city moving forward.
So, germane to this request, the next step would be for us to receive sort of instruction. I guess what we're looking for here today is endorsement from, well, not today, but on Wednesday, endorsement from the governing body that a motion from Housing and Community Development through an agenda item to address that home ARP allocation would be welcome, right? We're already under a commission approval for the 2.9 million allocation towards non-congregate shelter, and we're making the recommendation now that amending that cost allocation plan for the formal submission to HUD would be the highest and best use for Augusta, Georgia. So it would be, as many things described in the plan, it would still come before the body for a vote as an official action of Augusta, Georgia. But to speak for the team, and I'm not speaking for my director either, but we would not feel comfortable taking it upon ourselves to just come before the body and say we wanted to contradict an existing approval from the commission. So in this environment, we thought it was appropriate to bring it to your attention, let you know that we see it as an investment from the task force perspective that can make impact in our community. And if the feedback today suggests that that's the direction that Augusta, Georgia would like to go, it could then come before you as a formal action that we would take in our correspondence with Housing and Urban Development.
Okay. Like I said, you might have answered what I asked you, Mr. Evans, and I appreciate that.
Yes, sir.
And I think so. You said at the meeting in the very near future, you want us to allow you to allocate the $2.9 million to do these homes that you're speaking about.
Yes, sir. And if it's the will, I mean, if it's the will of the commission, the utilization of the full award, so that would actually be a little more than that. The full award being a little over $3.1 million could go towards the development of permanent supportive housing. Is again, the intent of the program is to provide housing and service opportunities to those at risk of or experiencing homelessness. So making the investment in totality, minus the cost of administration that Augusta, Georgia is afforded, would be a prudent investment. It feels like a rare one-time opportunity to make such an impactful investment on this subject matter that we would certainly want to hear the input of the commission on a decision like that.
Okay. Well, I got two more questions,
Okay.
Mr. Chair, and I'll be gone.
No,
and that's
please
to Miss Linda. I think it's Miss Linda, and to Judge Watkins. Ms. Linda, I'm just going to make a comment based on what you made about what caused your program to fail back in 2004 that you believe, and I don't know whether you're referencing the governing body, and if that's the case, I do want you just to remind you that a third of us won't be here next year. So if that's just keep that in mind. Myself, the mayor, Commissioner Sayers, Commissioner Dennis Williams, which becomes a third of us won't be here, a little over a third.
And that's what I was trying to explain. And I apologize. Those of you who know me know I'm passionate about this. So my passion shows. And yes, that's what happened when the leadership left. There was nobody directing the choir. And that's why we need this position to make sure that these strategies move forward. Yes,
Well, with that being said,
that.
Ms. Barr, I'd like to say this here to you then, if you don't mind. In my mind, and I could be wrong, I operate backwards like I have dyslexia from time to time, and that is, you can hire a person with all the skills in the world. I believe, this is me talking, totally I don't have any organizational skills, that can have all the skills in the world to see the vision that you want. But I think for me, first, you got to get a solid commitment from those entities who's going to be there, then bring that director in. Because you can bring the director in and you got nobody who wants to play ball.
I have to tell you, not only will we have a team, but we got a backup team.
Okay.
And so this is the time to play ball.
Okay, all right.
Okay?
Thank you, ma'am. Judge Watkins, if you don't mind.
The judge is being called to the stand now. Go figure, right?
All right. Yes, sir, Mr.
Judge Watkins, how you doing this afternoon, sir?
Pretty well, sir.
Judge Watkins, I'm going to share something with you so you won't feel like I offended the judge, to my colleague's point down there. There was a conversation a couple of years ago prior to you becoming this state court judge that my colleague was having among ourselves, and one of the questions was asked, well, who's going to be the next state court judge? And they said Judge Watkins. So I'm letting you know, so this has been done before. What I'm about to ask you now is, based on what we're hearing today, you are talking about the state court taking on a mental health court. In about 8 months, myself and yourself will be going to the House. So my question becomes, who is going to be your next state court chief judge? And have they been spoken to about bringing this program into the state court?
Yeah, the next state court chief judge will be Judge Kelly McIntyre. She is already involved with, and all of this would fall under our accountability court umbrella, wherein we have a multi-level DUI court, a first-time DUI court, we have a veterans court, and the mental health court, hopefully. And she is now working with the domestic violence court. So she is already transitioning in, and probably within the next 90 days or so, I will, for lack of a better word, begin training her.
Thank you.
So she will be the next chief judge, and that's what we're doing to get her prepared.
Thank you, thank you. Thank you, Mr. Co-Chair, I appreciate it. Thank you. But I will, at the end of everybody, there's a young lady with her team here that's already actively involved in homelessness, and I'd just like you to give them about 5 minutes at the end of your question, a regular question with Ms. Mary Stewart, someone who's been reaching out from time to time, and she have her team here today, and they want to take about a few minutes at the end of all of your presentation to share who they are and what they do, and what they will, if they see a way where they can get involved with this. Thank you, Mr. Co-Chair.
Thank you, Commissioner. We have another question, Commissioner Franham.
Thank you, Mr. Chair. Thank you all for coming out. This is awesome. A couple of questions I had is, y'all talked about the success story of the 7 people, and I know at some point we had talked about a funding source because private dollars have to fund that, and I know there's a lot of people watching, a lot of people that want to support where we are on setting up that with the Community Foundation, or wherever we're going to set it up.
The Community Foundation has agreed to act as a host for that money.
Okay.
And when we find a client, they will write the check. Once we check the background, make sure the family, there's family at the other end, or services connected to that person leaving. So if we get donations in, they're to be made to the Community Foundation for this purpose, and they'll be utilized to reunite families.
Okay. Any attention, or is it just Community Foundation?
I think I'd send it to Rebecca Wallace because she is the one that got the maybe attention. Rebecca Wallace might be
Awesome.
good.
Okay. So all media, if you can make sure that's on your screen tonight, greatly appreciate it because we need all the support. So my other question was, about 3 questions. How many of the numbers that Sean put up are school kids? And have we had this discussion with the education system?
That's a great question, Commissioner. Yeah. So to disaggregate that a little bit, there's some often confusion in the conversation every year around point in time, especially when it comes to homelessness. The Board of Education, governed by their rules and federal laws, defines homelessness as almost all versions of housing instability. So we have also recently heard reports from the school system of over 900 homeless children. We are not able to categorize people that far broadly. So literally homeless in our most recent count was about 6 children under the age of 18. Our homeless shelters do not have dozens upon dozens of children, but there is an issue and a need for collaboration there because some of the supports have strained through COVID to support the homeless students in our shelters as well. So again, I think that our representation is somewhere in the middle between what we hear from the school board and what our data is able to suggest through the outreach team efforts and through our point in time count.
Okay. The service coordinator that Ms. Barr spoke of, which I totally agree with because there's got to be a captain of the ship. Could grant dollars or federal dollars handle that, or is that something that would have to be, I guess, general fund?
That is the conception, is that it would be a leverage between local resource and federal resource as well in order to sustain it. Yes, sir.
Is that something this body has to approve?
Absolutely. So we would like to know if this body's interested in seeing that inclusion, and then we would have to workshop that from a government standpoint to bring it back.
Well, even though a third of them are leaving, there's 7 of us will be here, and we're going to make sure to keep this ship moving. So we definitely need to have that conversation, Mr. Chairman, and put that forward. On the bus travel situation, where you talked about the utilization of people to get from point A to point B. Again, that'd have to be approved by this body, and would we use that as far as like through the service providers and nonprofits, where we give them like vouchers to hand at the bus?
Well, we've had existing partnerships. Augusta Transit is actually very open to this. You guys may remember back in February, we hosted the Homeless Resource Fair. They were very generous with providing us with some bus passes to ensure that people got there. And let me highlight, they provided a dedicated shuttle service to return people to where they came from after the event was over. So we don't need specific authorization, but I think just acknowledging with this group as part of the conversation that has happened before. Our office, Housing Community Development, has partnered with Transit to support bus passes as part of Point in Time every year. So we just want to ingrain that and keep that conversation going. And if we do take on some new aggressive initiatives that have bigger need for transportation, we'd like to know we had a welcoming environment to come back and say, we're asking for this type of investment for maybe longer term passes, because these transactions have all been single ride with transfer tickets that have about $1.50 value to them. But we could see partnerships in the very near future where for day shelters and things, giving someone a weekly pass would make sense so that they had something a little more consistent to use or something of that nature. Gotcha.
And then my final one is just around the day shelter. Like, I know, like, what are your thoughts on timelines? And then, like, as far as like, can this government use ARP funds for that, something like that, or is that something? I'd love to know that answer as well. Like, what? First, give me kind of your timeline on.
Sure. So as I mentioned, we're happy to learn through this environment that we have a operating homeless day shelter now in the Harrisburg community. I hope they don't mind I shout them out. They do great work. They're called I Am My Brother's Keeper over on the Fenwick and Telfair area. So we want to grow their impact. So that's immediate, and that's happening already. That's independent of the Homeless Task Force efforts, but Director Welcher and I have had a chance to meet with them. Members of the body have had a chance to meet with them, and that is an existing resource to grow. Ms. Bars and I have had the fortunate opportunity through this task force to have conversations with the owners of Green Street Mission Center, and they are interested in standing up a day shelter to expand the services that are currently provided there throughout the week. And so we could envision a 60 to 90 plus day window where we could be having operating services within that facility potentially.
Awesome. Okay. Well, thank y'all all for your information and questions answering. Thank you.
Yes, sir. Thank you. Commissioner Clark.
Thank you, Mr. Chairman. I have a couple of questions here. I appreciate y'all's diligence in trying to find solutions to help get people with many problems off the street. And as we all know, the many deal with mental issues that the law cannot dictate them to seek treatment, nor can they dictate them to continue on their chosen medication or prescribed medications. And that's something that I don't think anybody's got an answer for. Certainly we can try to help find an answer to that. I'm also concerned about people that are on the cusp of being homeless. I don't know if many people are aware of it, but here in Augusta, Georgia, approximately 26% live at the poverty level. They're one paycheck away from being on the street. So I'd like to know, is there any stop gaps to help prevent that? And the other thing I want to ask, and it's the elephant in the room that everybody's thinking about and nobody's asked. We have many people living in our local motels. They work. They have children that attend our schools. And I understand commerce, and you can't relocate private commerce. But in about a week, we're going to have a lot of those people homeless. They're going to be on the street because they can no longer afford their motel room. What are we going to do to help them? Thank you.
Thank you, Commissioner Clark. And Ms. Bars may jump in here. So we are very aware of this issue. As I mentioned, as recently as this week, our partnership has had to deal with the influx of demand for shelter services from some activities that were discovered for some what I would refer to as some illegal sheltering. And so that informed and sped up the conversation, if you will, among community partners to see what we could do to ensure shelter capacity with what could be a incoming influx of need that you referenced for Masters Week. So we do have a collaborative partnership between our existing shelters at the Salvation Army Center of Hope and Augusta Rescue Mission, also including some non-traditional resources such as our partners at Safe Homes to meet family needs if they exceed the demand that the Center of Hope can meet. And we have a transportation component to connect all these different facilities together, basically leveraging all those available beds that are there that may not be used otherwise to help meet what could be a growing need. There is some hope. I'll just share anecdotally, and we can have some follow-up, but our wonderful colleagues in the law department did update us recently that there has been some action in the Georgia appellate courts that suggests long-term residents should not be unduly removed from their hotel rooms without an eviction process. As I recently as yesterday had to let someone know, the fact that it's been overturned in an appeals court doesn't stop it from happening. So that is a concern. They may be able to seek a judgment on the back end, but they may be illegally barred from their rooms that first week in April. I don't know. We also don't have a great estimate. You know, I can share as one of the members of the point in time team that went out Washington Road on the night of February 22nd. There's a lot of folks living in our hotels. And I knew that, but I saw it with my own two eyes, just what you said. Families with children, a lot of people coming and going in work uniforms, clearly living their lives based out of these temporary locations. We don't have a great answer for that. Our emergency shelters are there. They stand ready to assist, but without a clear, defined anticipation of what that need is going to look like, we can't guarantee that we'll be able to meet every need, but we feel we've put the resources in place through those partners this week, and I want to commend Mrs. Bars for her effort in coordinating that to be prepared for that coming onslaught.
Thank you.
Yes, sir. Sorry, I didn't address your question about vulnerability, sir. You spoke about those in our community that are at the risk of homelessness. We really did want to make sure we focused in on that. And so, again, there's been a very aggressive and intentional conversation for months now about the development of that single point of access and better publication, for lack of a better word, of the resources to help prevent people from experiencing homelessness in our community. So that's one of those early action activities that we look forward to the ability to come back in very short order and update the commission on progress towards seeing some of the efforts that our community envisioned many years ago existing for those resources finally coming to bear. So we want to see better collaboration. We want to see better coordination of those services specifically, because our homeless crisis response system, to the point you made, sir, could not handle a massive influx of need right now. We are at full capacity across the spectrum, and if there was something that would lead to widespread evictions or widespread housing people losing their housing on a large scale, we would not have an effective immediate response as it exists today.
And I appreciate your answers, and I appreciate the due diligence that y'all are trying to address this. And I think I can speak for everybody up here on this dais that we're here to assist in any way that we can, because this is not only an Augusta problem, it's a national problem. There's tent cities going up all over the United States that, some of it thinks that that's the answer. It could be, but then you have many other aspects of sanitation and things like that and sickness. So I don't think there is a clear-cut answer, but all we can do is move forward to try to find a solution. But thank y'all so much.
Yes, sir. Thank you.
Thank you, Commissioner. Mayor Davis.
Thank you, Commissioner. Mr. Chairman, thank you. I want to applaud the efforts of the Homeless Task Force to bring us to this point in the conversation. I know it's been a long time coming, and there's been patient and very thoughtful work that's gone into where we are today. I have just a few questions in typical fashion, and I'll start with on page 36 of the handout that you gave us. And when I say handout, I'm speaking specifically not of the slide presentation, but rather this document here. And on page 36, you have the logic model, and it looks like that is going to be a work in progress.
That's correct, sir. Yes,
And
sir.
the appendices talks about a host of other things. Does the same hold true for the appendices, that those are things that will be delivered later?
Yes, sir. So our hope here today is to provide you with the content for your review and your input, but what will be considered the final strategic plan would incorporate all of those attachments. We didn't want you to get a phone book today and feel like you couldn't get through it all. But those documents are created. To your point about the logic model, those are going to be the organizing tool to move the work group actions forward from some of the recommendations we've discussed here today. So yes, those will be created in those elaborative steps going forward.
Absolutely. So those are critical documents that really are what I call the framework for success.
Yes,
Would
sir.
you agree with that?
Yes, sir, absolutely.
All right.
Accountability tools as well for us is making
Absolutely.
sure that the efforts are being pursued as we have described them to you today. Yeah.
Absolutely. Secondly, back on the slide presentation, Ms. Bars, you talked about in 2004 that there was a strategic plan that was put together. Is part of that or elements of that included in the skeleton for the strategic plan today?
Yes, sir. There are some strategies from 2004 that not just in Augusta but nationwide are still very relevant, right? And to Ms. Bars's point, we'd like to see them delivered on in a way that they weren't from that original conception. So certain concepts have changed names, perhaps. Transitional housing is less relevant and things of that nature. But yes, sir, a lot of the springboard that came for this effort was from that document.
Okay. And then I'll close with these series of questions. One, thank you for the presentation today. Number two, as we trek towards some meeting on next week, what is it you've come today to ask for?
Today we didn't have an ask specifically. Today was to provide you with the information and set the framework for the long-term conversation going forward, but also the opportunity. I believe Commissioner Johnson wants a few of the action items we've described on the agenda for your Wednesday meeting next week. Principally the instruction to Housing and Community Development to make that consideration about the Home ARP Award, and specifically to provide some feedback on some of the other ones like the homeless coordinator position that was mentioned by Mrs. Bars. Again, as my preamble suggested, we weren't here today nor Wednesday to directly impact the business of Augusta, Georgia, but rather to receive a tacit endorsement that this is what the commission wants to see its community doing. This is the effort it wants to see going forward, and we need an endorsement. In my estimation, as one of the authors of the document, we need an endorsement from this body that we're moving in the right direction to provide some encouragement and faith to those private stakeholders that have been engaged with us over this process, to know that this is not going to fall on deaf ears for the actions in the near future that do require engagement with this commission.
All right,
And
so
Mr.
if I were to capture that, then I think what I'd heard you say that there are actually three asks that we have. Number one, we'd like for the commission to affirm the work that's been done to date, to include what you've presented with the strategic plan framework. Number two, you'd like for the commission to affirm on next week the $2.9 million ARP dollars that have already been talked about. And then thirdly, you'd like affirmation around the hiring potentially at some level of a homeless resource coordinator.
Yes, sir.
Okay.
And then
Because
also to bring additional clarity here, and great questions, Mr. Mayor. To bring additional clarity, this body, voted to form the task force and voted to have us come back with recommendations. This is just our opportunity to work through some of the details. The Honorable Hassan always tells us that the devil is in the details. And so we want to bring back these details today so that next week we can approve this actual strategic plan so that anything that needs to move forward can move forward. But of course, if it has to come before the commission for approval, they're going to be coming back anyway. But this, again, speaks to what Daniel and yourself just spoke of. We can't move forward without the commission saying, okay, these are the strategies that we want to employ to address homelessness in our community. This meeting is our opportunity to add, delete, review, and next week would be our opportunity to pass and make it a matter of record.
Absolutely.
Mr.
If I
Chairman.
can jump in, sir.
Hold
One
on.
moment, Mr.
Yeah.
Mayor.
Yeah, Mr. Chairman, if that's the case, and again, I don't think there's any question, I'm fully supportive, which is why I went back to the three things. Now what you're saying is you'd like for the commission to approve the strategic plan, but Mr. Evans just indicated that the strategic plan is still a work in progress because you're wanting to complete these things around developing an action plan, which is predicated on the logic model, that would not happen just yet. Rather, those three things that we talked about are predicates for getting to the strategic plan and being able to implement it.
Correct.
Is that not true?
That's true.
Okay.
I just, if I could, I feel like I've done a disservice by overlooking the comment Commissioner Johnson just made. A big part of today is also feedback. We wanted to provide you, not in the room, we're not expecting everything you want to know to happen today, but for those of you that don't have it, my contact information has been provided as a messenger for the group. But as you have an opportunity to look at those strategies that have been recommended to you, this body represents some of the most important stakeholders in our community. And so in addition to approvals and instructions, we want to know what it is you would like to see as well. And we've not had a broad spectrum opportunity to do that with everyone on the commission or yourself, Mayor Davis. So thank you, Commissioner Johnson, for making that statement, because I really failed to say that earlier. And that was a crucial part of having the workshop today, was to inspire the ideas and thoughts that you would like to see incorporated back into what is the final draft of this plan.
Thank you, Daniel, for that clarification. Commissioner McKnight.
Thank you, Mr. Chairman. Yes, can we get a copy from Sean of the presentation he did sent to the commission?
Absolutely, yes, ma'am.
Okay, thank you. I got one quick question to ask, and if we, we're listening to all this, by doing all, do you think that this will be something that will be bringing other homeless from other cities and counties to Augusta, because we will be providing, or so to speak, the homeless? Do you think that they're going to come here because maybe they don't have that in their cities, or can you help me there with?
That's a very attuned question, Commissioner McKnight. Thank you for that. That's very important, and I appreciate the opportunity to address that. On a certain level, and again, I've had this role with the city almost 10 years now, so I can say this from speaking with other communities of different sizes across our region that have that issue as well. As a universal statement, all people, certain people will move to pursue opportunity, correct? And that can be sometimes in a more mainstream conversation, employment opportunities or better housing in a different community. To your point, could that be an attraction of more services for homeless persons? It's not beyond the realm of possibility. But I will say, to a comment that Corporal Rhodes made earlier in her presentation, if you'd like a hot meal or a blanket, Augusta, Georgia's got you. But if you want a long-term solution to your housing instability, we're not currently one of the best magnets for you to come towards, right? And I don't mean that as an untoward or disrespectful statement, but I think there is a misperception that happens a lot. Some of the data that we collect both regularly through our homeless management information system, but also through the point in time count, is asking people to identify where they came from, where they first experienced homelessness, and things of that nature. 30901, 30907, 30904, 30906 are almost always our four highest response categories. We do see people from other communities that have experienced homelessness and come here. That happens in the veteran space a lot as well, because we have two very good VA medical centers here and not a lot of great affordable housing options, so people sometimes get caught right in between those two availabilities for them. So yes, I think that to say it's a non-zero chance, yes. Do I think that the establishment of a low barrier shelter or the construction of permanent supportive housing units would see a mass influx of persons from other parts of the country? Not necessarily. We see other partners other communities that have very robust inventories of resources, and they don't see tremendous importing. They see a lot of people that grew up where they live and they fell on hard times, and that makes it even harder for them to leave for somewhere else. And so the majority of our homeless today are original or native to Augusta, if you will, and I think that's a pattern we can expect from a majority standpoint going forward.
Thank you so much for y'all's presentation.
Thanks for the question. Yes, ma'am.
You're welcome.
So as we bring our meeting to a close, I want to, before we acknowledge Ms. Stewart and her partners, we want to say, you don't want to, okay. Ms. Stewart waves. Well, listen, as we are here to a close, thank you, Linda and Daniel, for your presentation. And I want to also give thanks to the members of the Homeless Task Force who have shown up literally every month since we formed this task force about a year ago, and they've brainstormed and they've put something together that we all could be proud of. I usually open every task force meeting up by saying that what we do today will without a doubt change Augusta forever. And it will change Augusta forever for those who need it the most. Something that we have the ability to do, and it's something that we should all be proud of, because what we have placed in motion today, again, will change Augusta forever. And we should all be proud of that. So thank you for your efforts to the task force. Thank you for your vote of confidence to this commission for even standing up this task force. And please, let's make it be known as well that this task force will not end today. It will not end on Thursday. We're going to continue meeting. We're going to continue with results. In the final moments, I want to recognize Commissioner Dennis Williams, who was co-chair of this task force. He had a lot of dwellings with the school system and a lot of other plans that he got into this plan as well. So I want to recognize Commissioner Dennis Williams for comments.
Thank you, Mr. Chairman. One good thing about being last, you don't have much to say. But I think our purpose this afternoon was met by having this workshop, giving our fellow commissioners, members of the community, and of the committee a good understanding of what the task force job really was. And a lot of times things don't get going because those that make this decision don't have a clear and understanding of the project. Here today, with the questions came from my colleagues and the presentation, I think that we're able to go back and make a much better decision when these items come on the agenda. And also, we can provide recommendations from the committee to the public as commissioners. So I'd like to thank everyone for their time, their attendance, and their questions and their understanding. Mr. Chairman, thank you.
Thank you. Are there any other questions from my colleagues? Any other items to add for the benefit of this conversation from Daniel or Linda? No? Okay. Well, with that being said, this work session is adjourned. Thank you all so much for being here.